Okay, I'd like to call our Board of Health meeting for the 19th of February to order. Our first order of business will be election of officers. Before we start that, I thought it'd be nice if we went around the room and introduced ourselves since we have a new board member. Welcome.
Thank you.
I'm Lori Tritt. I've been on the Board of Health, I think, for 16 years now. I joined when Dr. Pennington retired from the Board of Health, so I could be the veterinary liaison for our county. I've been vice chair for about a year and a half now, I think, since John Fry stepped down. And I fill in when there's no acting chair. So here I am today.
Hi, my name's Amory Ream Taylor. I'm a pharmacist. And I have just joined the board, I think maybe a little over a year ago. It hasn't been that long. So I'm the newest person along with you. Yeah.
I'm Leanne Minton, and I'm just a member of the board, and I've been here so long. I'm older than most of those young people there. And I keep telling them I need to leave, and Monica says no, and she said no, and so I said, okay, I'll, because I like to come. And I'm real pleased that Ms. Schenkel's here, because my friend is Jim Driscoll, and he called me up and told me about her. And unless he lied to me, we're gonna like her.
You want me to?
Oh, yes, please.
Hi there. I am Casey Johnson. I am the Director of the Environmental Health Division for the Health Department.
Hi, I'm Jamie Greenwald. I'm the Finance Director.
I'm Natalie Johnson. I'm the Director of Nursing, and we have Nikki Hanna, who is the Deputy Director of Nursing back there.
My name is Justin. I'm the Emergency Preparedness Coordinator for the Health Department. And then I have our intern, Brianna Carpenter, over there from Eastern Michigan.
Hi, I'm Courtney. I am the administrative aide. So I'm the secretary for the Board of Health.
And I'm Monica. I'm the health officer. So please share with everybody a little bit about yourself.
Okay. I need to push this button?
Yes.
No.
Yep, it should be
it's on.
green.
It's on. Okay. My name's Darcel Schenkel. I've been a registered nurse for 45 years. I had to figure that out this morning, so I can tell you. And I've worked in oncology for the last 35 years in both chemotherapy and radiation. I was a manager for about 10 years probably. And I also worked in the EPIC department, helping to bring up the new computerized medical record. So that was interesting for a nurse to do that. But yeah, I'm pleased to be asked to do this. I hope I can be a good addition to your board and help to make decisions. Thank you.
Well, we welcome you
Thank
and
you.
hope you'll be another piece of our little puzzle here. Okay. All right. So I've not had to conduct an election before. So our first office is the office of chair. So we'll welcome any nominations.
I'm going to nominate Lori Tripp.
I'll second. Do you have to second it or anything?
Thank you. Any others? All right. All those in favor, please say aye.
Aye.
Any opposed? Okay. Our next office will be that of vice chair.
I'm going to nominate Terry Collins. Don't know whether it's fair to him or not, but that's what I'm gonna do.
I will say a prayer for Mr. Collins because he's, I understand, pretty sick right now. So we'll say a prayer for his
Recovery.
quick recovery, hopefully.
And like for this board, it's okay that he's a city commissioner. He can still be like the vice chair. Is there any conflicts?
I don't think
Yes,
so.
I couldn't hear you. Pardon me?
He's the commissioner. I just didn't know, but he can still be the vice chair or chair.
Yeah.
Oh, sure.
I believe you can, but
Yes, you
I
can.
didn't know
yeah, I wasn't 100%.
any rules. That sounds good to me.
Okay. Hearing no other nominations, all those in favor of Terry Collins as being our vice chair? signify by saying
Aye.
Aye.
any opposed? All right, and our last position would be that of our board secretary. Traditionally, the administrative aide takes that position. So I will recommend that Courtney continue in that role.
I'd go along with your recommendation.
Okay. All those in favor, please say aye.
Aye.
Any opposed? Okay. We have a slate. Our next order of business will be the approval of the agenda.
I'll make a motion to approve the agenda.
I support that motion.
Okay. Are there any additions or corrections that we know of? No?
No.
All right. So all those in favor of approving the agenda as written, please signify by saying aye.
Aye.
Any opposed? All right. Our next order will be the approval of the minutes from December 18th of 2024. If we all had a chance to peruse those? Any corrections or additions? All right, I'll entertain a motion to have the minutes of December 18th approved.
I move we approve the minutes of December 18th, 2024.
I support.
Okay, all those in favor, please say aye.
Aye.
Opposed? All right, the minutes stand approved. We'll next move on to the review of the accounts payable report. And since we have 2 months of reports to do, I thought we'd do the December report first. Approve that, and then we'll work on the January report if that's okay. Are you ready?
I am ready.
Okay, traditionally, Darcel, I kind of ask all the questions about this. Anybody else can chime in, so don't feel that I have to be the only one.
Okay.
All right. On page 1 of our December report, about halfway down, Gagarin, Luco, and Miller.
That is an additional legal fees for the Medina Hudson lawsuit.
Okay. And the next page, the LRS LLC, I mean, I know that's for our recycling,
Mhm.
but then lower, there's a Stanley Marshall.
Yeah, Stanley Marshall is the one that is currently contracted to open the recycling center on the weekends and
Okay,
kind of tidy up. So it's actually almost a full year. He had not given us invoices for quite some time.
okay,
So we got them all from him.
gotcha. So there they are. All right, and then on the next page, top notation, the dues assessment for MALF, did that go up this year? From last year?
I believe it remained the same.
Yeah, I don't think that one altered at all, no.
Okay.
And that's just annually.
Okay, those were all of my questions from the first report. Any others? Okay, so I'll solicit an okay for the report for December 1st through the 31st.
I'll make-
I move we accept the accounts payable report for December.
I'll second.
All those in favor?
Aye.
Aye. Any opposed? Okay, report accepted. We'll move on to the January report. So on the first page, the first bank card, can you explain those?
Yeah, the first item on there is Holiday Inn. That is food training for our newest sanitarian. The next 2 items, Hampton Inn refund. There was a double charge in November for hearing and vision. She had gone to, well, it was like a 2-week training for the hearing and vision program, and they charged us twice. So the way it fell on the refund, it bounced to a different month.
Okay,
Total Access Group is in order of condoms.
okay,
Project Energy Savers Solid Waste is actually these lovely stickers she got as part of her outreach. It's to prevent food waste. Like it says, you put it on your food. It says eat today, eat this week. You can dates that you put it in the fridge, dates you're supposed to take it out of the fridge.
Mm.
These were kind of cute. And informative. Oh, and then there's some composting stickers attached to it as well. The rubber stamp warehouse was a stamp because these are not specific to Lenawee County Solid Waste Department. She purchased a stamp so that she could stamp it on here so that we didn't have to purchase more stickers. Oh, I'm sorry.
okay,
Just to identify where they came from. Avility is the program that we use for Blue Cross Blue Shield to be able to run claims and submit claims and verify insurances.
mhm,
NEHA is National Environmental Health Association. That's the credentialing for Casey. The next one is MJR Adrian Event Contract. It coincides with the one right below it, the Wellness Event Meal. This year, we had gotten a wellness grant from the state, and it allowed us to do a training as well as a fun event for the staff. So this year, we chose to go to MJR to I forget what we ended up watching. Well, we had a training and we watched a movie and we ate some popcorn.
sounds.
A lot of team building there.
Yep, team buy.
Family fun. Now the availability on this one is because this particular bill is a 2-month bill because the month prior with the 2 refunds on the hotel, the bank technically owed us money, so they lumped it all into 1-month payment.
Okay,
So this is also availability is the same as the month prior. Gannett subscription, this year we decided to change our Daily Telegram subscription from paper to digital because we were having a lot of issues receiving the paper version. So at least with digital, more staff in the office could look through it.
mhm,
The MSU compost exam is part of solid waste. As one of the requirements for her program is to be a master at composting. So by taking this class, she can also teach others on proper composting and what should go in there, what should not. So she took that exam, the class she had taken a month or 2 prior. And then Postal Plus CD, that is actually, we anticipated that to be a very hefty charge, and 25 was actually great. We had to overnight a specimen to the lab because it was brought in on a Friday. So that's what that is that
Okay.
particular specimen.
yep, they cut you really good there. All right, and the next page, the Maliha membership dues. That's, I think, remain the same.
Yeah. Yes. I'm sorry. Yes, $50 for the Maliha. Yep.
Okay. And that's all that I had on that report. Any other questions? Okay, I'll entertain a motion to accept the accounts payable report for January of 2025.
I move we approve the accounts payable for January 2025.
I second.
All those in favor? Aye.
Aye.
Any opposed? Okay, motion passes. We're on to our health officer's report from Monica.
Good afternoon. A few department highlights that I wanted to share. Last month was National Radon Awareness Month, and we distributed 193 kits to residents. And also we've had a Narcan vending machine in the clinic waiting room since April of last year. So from April to December, there's been 155 doses that have been taken out of that. So that has been pretty impressive and very active area in the clinic waiting room. Respiratory illnesses are very high, especially influenza A. COVID is decreasing and RSV is decreasing as well. Pneumonia in our county is showing a slow decline. Emergency department and urgent care visits have declined over the month, and most adults over 50 are the ones that are being affected, and it's less peds this time around. Avian influenza, there has been multiple backyard flocks detected since January 1. Also, there is 68 human cases. CDC does say that there is there's no risk to the public, or it remains very low. And so I thought I would just share with you what CDC focuses on to kind of select how these risks are. They look at how the virus is transmitted, the disease severity, the case distribution, like how widespread are the cases, and the effects of the genetic change within the viruses. Because the viruses are mutating, the D1.1 is what is being found in humans, and also it was just recently found in dairy. So that's kind of what they look at, those 4 different risk assessments to determine what the risk to the public is. And I thought that was interesting, so I thought that I would share that. The statewide septic code at the end of the year was so close to passing, and it did not go through. So it is intended to be reintroduced this beginning of this year. So we're going to expect to see that come back around. And there has been a lot of changes in the federal administration. We have not been informed of any changes to our program or funding or anything like that. So we are continuing as we have been for the previous years. And I would entertain any questions.
Thank you, Monica. Do we have any existing business?
We do not.
Okay, we'll move on to new business then. Our first discussion will be about meeting dates, and I'll let Monica handle that.
The meeting dates, the county has established a opioids gap subcommittee. And this subcommittee is going to take a look at just where there's gaps in Lenawee County to use for the opioid funds that the county is receiving through various settlements. The meeting is slated to begin at 3:00 on this day. Our meeting starts at 4:00. To prevent late starting for us, because they do anticipate a lot of presentations and, a lot of community members being in this meeting and being very active. I would like to propose that we change our meeting time to 1:00. That would prevent us from starting late or making the other subcommittee end early and not being able to see any presentations. I would like to, just have a discussion and get your thoughts. But the proposed time is 1:00 the same day, the same week, just earlier in the day.
I will not be able to come. I have a team meeting for work Wednesdays, 1:00
Okay.
every week.
Would that be every Wednesday? Every month?
Yes. So instead of 4:00, it would be 1:00.
Okay.
Is it possible for them to start at 4 and us to do the 3:00 time?
I could pose the question. I'm unsure. Is your meeting until 2, or when does
Usually just an hour.
just an hour?
Yeah, like every once in a while they might change time, but if that happens, it's usually earlier on Wednesdays.
Okay.
But 1 to 2 is
Okay.
the
Okay.
weekly meeting.
What about you, Leanne? What's your thoughts?
I could do 1 or 2.
Darcel?
I don't have conflict.
I think it all depends on a ride, but
Okay.
the 2 would probably be easier for a ride, but do what you need to do.
Amory, would a 2:00, would that work, or would that just not work?
Yeah.
No, because yeah.
Yeah.
Okay.
2 won't work for Avery either.
No, it doesn't.
No.
1, because I have a work meeting, 1
Okay.
to 2. They might go over a couple minutes, but that's
Okay.
every week.
Okay.
Would 3 be okay for you? Like if we pushed ours back an hour potentially? Would a 3 PM work? Do you know? For a ride for you?
Leanne,
Oh, yes. Or you're talking to me?
Sorry.
I'm sorry. I thought you were talking to Avery.
No,
Yeah, 3 p. I'm telling you, time would, I'm sitting at home. You just tell me what time to come. I'll come.
okay.
You tell me 8 o'clock at night. Probably not, because people I know are too old to drive at night, but
okay. So what I'll do is, would 2:30 work for you, Amory? Or not necessarily, 3 o'clock is better for you?
Yeah.
Okay.
Yeah.
well, recently we've not been going 2 hours.
No, we have not. So I will take this back to administration and
Maybe they could meet at 4:30.
and see what we can do.
Mhm.
Okay.
Don't
All
we
right, I
have
will-
some seniority?
Well, we do. I don't want it to impede on our meeting or their meeting. So
Right.
if we could change it a little bit, I was
You're
just
trying to
getting,
be accommodating.
I am. So I will kind of take it back and see if we can kind of flip flop or what their thoughts are on that.
Okay.
So, okay.
All right, thank you, Monica.
Mhm.
We'll move on to the Plan of Organization 2024.
So I've submitted for your review, the plan of organization. This is a requirement for our accreditation. Our accreditation is scheduled for powers and duties is May 28th is getting reviewed. This cycle 8, as I stated in kind of the brief overview that I supplied, is looking a lot different due to everything kind of just halted during COVID. And so they're coming back just to kind of review and look at everything. And it's not a met or not met. It's not corrective actions. It's just a reviewing and to make sure that everybody's on track. And it's mostly because there's so many new people. And, most of us sitting here have not been directly, I have not went through it myself. So it will be a good experience for everybody. As part of that, a plan of organization is a requirement for our powers and duties. So I have supplied that to you. And I do need the board's approval. And if I get the approval, then Dr. Tritt would need to sign off on that for me to submit to MDHHS.
Is this basically the same organizational plan that's been in existence?
Correct.
I thought so. Well, I move that we accept the new organizational plan and present it. I would call it the A to Z plan because I kept listening and it was A, B, C. And I kept.
Right.
Yes,
we
it was
gonna get there?
120 some pages. Yes, it's a
And it was-
big plan.
Yeah, Courtney asked me if I wanted all 20 pages, 120. I said a summary will do. And I said, frankly, I think for everybody, a summary might do. Any rate, I would move that.
All right, do I have a second?
Yeah, I'll second.
All right, all those in favor of approving the accreditation Plan of Organization 2024 signify by saying aye.
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 Aye. Any opposed?
Monica, you're gonna find it's a trip.
Yeah,
That
I already
accreditation.
am.
And all the rest of you
First
too.
one is like
It
not as
is,
intense.
because I have a lot of questions, so they'll probably be very sick of me by the end of it.
Do you need a Board of Health representative that day?
Oh, that's a good question. I don't know. It's another question.
Okay.
I will find out.
Usually one of us would at least be there for part
Okay.
of the day with them.
will
So if
post
you
that
do
question.
need that,
Okay,
let us know. Okay,
absolutely. Thank you.
all right.
I
Moving
think
on.
excuse me, I think I've told you once before, the one thing that I really, really remember about accreditation, we always do so well. And at one time, the environmental group only got a 99 rather than 100 because they did too good a job with too few workers. I've never, ever forgotten that. You were deducted a point because you did too good a job with too few workers.
All right, we'll move on to our program reports. We'll start off with personal health with Natalie.
So piggybacking off Monica, our programs down on the nursing side, we're all preparing for accreditation. We have 5 additional programs, 5, 6 programs that we are all preparing for accreditation. I am the one and only, well, Casey has been through accreditation, and it's a process, but you know, we're getting through it.
Good.
Also piggybacking off on the respiratory, we currently have COVID tests that we are giving the community. I will be ordering COVID tests, at-home tests that include the flu, A and B, and COVID all in one test kits. So we'll be purchasing those here shortly and be able to start distributing those out to people in the community. To highlight one of the things that we implemented last quarter was our social determinants of health survey. We started implementing that in all of our clinics. And we were able to, so I identifies housing, medication, insecurities, electrical, gas, all different kinds of insecurities. And we were able to get 506 surveys back from people in our clinics, which was awesome. About 30% of those did identify insecurities with transportation, medications, food. So we were able to partner with Lenawee Transportation, Pro Medical Farms for Vegemobile, and Adrian Medical Pharmacy, and we purchased gift certificates or tokens, and we were able to distribute 105 bags of 10 tokens to 79 families. For Pro Medical Farms, we were able to distribute gift certificates to 55 families. And for Adrian Medical Pharmacies, we were able to give 36 families gift certificates to either get flu vaccine, their diabetic medication, syringes, or anything like that. So we were able to assist 170 families total
My gosh.
for the last 2 quarters, which it's made a significant, impact on those people that can't afford to get their kids to the doctor, or we don't have programs where we can give free flu shots, but we can, give them, $50 and they can go to Adrian Medical Pharmacy. And a lot of people are getting their vaccines there. And we are getting more tokens, more gift certificates, and more gift certificates. So we'll have those for a couple more months. Does anybody have any questions for me?
Do those go out to the same people that you identified, or?
Yeah, so
Okay.
what we do is for one of my grants that I wrote, they are required to fill out this form.
Mhm.
And then we produce them with whatever resources that we have or resources within the community to be able to help them.
That's great.
Yeah.
Well, kudos to you and your staff, Natalie. Thank you.
Thank you.
All right, we'll move on to environmental health with Casey.
All right, good afternoon, everybody. As always, you have your reports. For the last couple of months, things have been very steady. We've actually are up on a couple areas, our well applications, septic apps, and even our site evals are a little up on where we were last year. We've definitely been, even with the cold, staying quite busy with folks coming in and looking to get permits and things like that. As Monica mentioned, we did just end Radon Action Month. That is always very successful for us. We get kits from the state and then they're offered for free in the month of January. So we had about 200 people come in and pick up those, which is always great to see. We do typically get those results back and we just kind of have them compiled in our office. And the state also has a map online that they now actually update for a rolling 5 years. So that's always available if anybody wants to see. We do have we are in what is known as a high radon area. So we always try to push it every January to try to get folks to come in and get their homes tested. So that's always good to see. We had one of our weekly meetings with our wastewater folks last week. And it's just always kind of nice to see, well, not nice to see, but interesting to see when the clinical side kind of matches up with the wastewater. Just as a reminder, we only get wastewater results for City of Tecumseh. But they have also seen a very large spike in influenza A norovirus, and then they've had a spike not quite as big in RSV. So it does kind of go along with the clinical results that we see. So you do get that correlation often between the two. We were finally able, I'm really happy to report, to hire a program secretary. Our program secretary, last one, left us in June. So it has been quite a search. Her name is Christina. She started last week and she has been wonderful. There's a lot to learn with that position, but she's been great and we're hoping she sticks around with us for a very, very long time. And then Monica had mentioned the wastewater bill did not pass, which we were pretty pleased with because we had some concerns that I think I talked about last time. We were not quite as happy that also there were some food law updates that also did not pass. Basically nothing passed. So everything that we wanted to pass died at the end of the last legislative session. We're hoping that they'll get reintroduced. But none of that has happened as far as I know as of right now, but they have 2 years obviously to do that. So we'll keep an eye out, and if anything comes back, we will let you know.
Okay.
I have a question about radon testing.
Sure.
Everybody else probably already knows this, but when you get a high radon
Yeah.
test back, is there some help for that family to do radon remediation or what happens?
So I don't know of any like financial assistance. There's not any that we offer. What we typically recommend is the kits that we give out are short term. So they're typically supposed to be in your house for like 3 to 7 days. And then we usually recommend that folks, they can purchase online a long-term kit
Mhm.
that I think they can keep anywhere from like 6 months, maybe even up to a year in their house that gives you a better reading. If it's really high, we don't typically recommend those because we want you to just retest with their short-term kit, because if it's really high, we want you to take action sooner. But there's not anything I know. I know it's fairly reasonable price-wise is my understanding. But we do have references or places that we can send folks that they can get a list of contractors, and we do often encourage them to shop around
Yeah,
and see if there's anybody who might be able to give them a better deal.
okay.
Mhm.
Thanks.
How long does it take to know if there are folks that have discovered radon?
Well, we get results every month. So we receive them, I think it takes a little longer in the around January and February, just because they do get quite a few. But the state gets the results, from the lab where the kits are sent, and then we get those on a monthly basis.
Okay,
So they don't give us addresses or anything like that. They give us just the kit number. So when we give folks kits, we keep track of what address goes with what kit number, so we can then line it up on the spreadsheets that we receive. So typically within the month, I believe, is I would say probably the latest that people should get their results. I think if you do it on more of the other times of year, it's probably a little bit faster.
So you don't have to follow up with results. They automatically get the results back?
Yes, the people, when you send it in, you can either put an email, or I believe if you just give them an address, they'll mail it to you. They also have on their website, if you have your kit number, you can go on and type it in, and if they have results, it will show up.
Okay.
All right.
Any other questions? All right. Thank you, Casey. We're on to Justin and emergency preparedness.
Alrighty, so we wrapped up our continuity of operations training in January. That went very, very well. All of our administrative team did an excellent job at dealing with the emergency pretty flawlessly, very little hiccups. And so I'm very proud of that. I took a look at our pandemic flu plan and our mass vaccination plan. It was a very lengthy plan, upwards of 40 to 50 pages combined. That has now been condensed down to about 12 pages of essentially how do we respond to it. One of the areas in the plan identified is all of our nodes of dispensing have contingencies of, well, if there's a basketball game or if there's a wedding, we don't have access to those locations. I don't really like that idea because, healthcare, I need access 24/7. So I've reached out to 2 potential locations that would not have these contingencies. So if we needed to activate a mass vaccination on a Friday or whatever, we would have access indefinitely until we needed it. So that's in the works there. Piggyback off the ordering, they're ordering COVID tests. We are ordering N95 mask and surgical masks just to replenish our supply. We have a decent supply on hand, but that'll bolster our staff's supply of masks if necessary. Hopefully we don't need those. Marijuana grant is also something that we've been working on in emergency preparedness in coordination with health education. So myself, Brianna, the intern, and then Becky Solenko has been working on a Let's Start Talking campaign to kind of talk about marijuana and medical marijuana in the essence of a neutral tone. It's not bad. It's not good. Let's just get the information out to the community for they can make their own decisions. It is legal, so they have the right to do so. That will include gas station TV ads, a social media campaign, and then uniquely a provider outreach where we want to put flyers in rooms that have questions such as like, what are the side effects of cannabis? So patients can start that conversation with their provider and have those informed decisions with their healthcare provider. And if I'm going to use marijuana, what is the best decision? Should I smoke it? Should I eat it? What should I do? What do you recommend? From an administrative standpoint, we work with District 1, right, their medical response coalition. So as of right now, we're being told their funding has been frozen as of January 1. So they have not received any additional funding. So we'll see what that means for emergency preparedness in that aspect and how we work with them. And that covers multiple counties in Region 1. And they just held the medical response surgical exercise. So this was where we all in the whole Region 1 pretended like we had to have a large scale incident. It was a pandemic RSV essentially. And how do we handle that and what information do we put out? So we participated as a local level of putting out, press releases and things like that, which went pretty quickly. I think within a matter of 30 minutes, me and Natalie had everything set out to the public in this demonstration. And it was pretty flawless, I think. Overall, not much going on in that regard from EPC. Thank you.
All right, thank you. We'll move on to Jamie with finance next.
Hello again. Okay, so this year, this month in your packet, I went with the quarterly financial statement and pricing updates, but I also included some notes concerning both of those. Just I hadn't done that in the past, but just to offer a little bit more context as you're reviewing your packet. Because I know just a lot of numbers might make sense to me, but not necessarily make any sense to you. So I don't know if you want to tackle the first part. We can do the financial statement first. Does anyone have any questions regarding either the notes that I included or the statement itself? It's first quarter, so it's pretty standard, to be honest with you. We've done a good job this year maintaining our targets in line with our budget. So, sorry, that's moving rather quickly, but you can see it up there as well. We do have, you can see on the screen right there, we do have a $181,000 not local dollars. So it is a excess of revenue versus expenses. Any questions on that? Okay. Well, then I've also included the nursing clinic pricing updates. I do quarterly updates for our vaccine prices just based on fluctuation in the market. The two most notable that seem to fluctuate constantly is Shingrix and the Gardasil. And those are still the same two that have kind of bumped the most. This time I've also included an update to visit codes and any testing that we offer, any procedures in lab testing. And now with this one, we only do every 2 years. So that is why there are a lot more differences in the ranges. This would use the relative value units, which is standard federally for all physician fee scales. And then we also base it off of the expense that it costs the clinic to be able to offer these particular services to figure out a price that is good for us, but is also not draining on the clients that we serve. Now, is there any questions on either the fee schedule or the?
I just had a question on the second page. You have all of these listings for health coaching. Available to anyone in the community?
That is actually, that section right there under the 99080 WW.
Mm-hmm.
That whole little grouping there is all for the Wise Woman program.
Okay,
We don't actually establish the pricings on those. Those are the reimbursement rates from dictated by the program in itself. But the health coaching is available for any of the clients within the Wise Woman program. And I believe there is an age requirement, an income requirement, as well as uninsured for Wise Woman. I don't specifically remember the age, to be honest with you, though.
okay. Any other questions? All right, thank you, Jamie. All right, do we have any public comment?
I have a comment.
Anything from the commissioners, Mr. Van Doren?
Thank you. No, we just want you to know that we appreciate all you're doing here and taking care of Lenawee County. So thank you for that. And thank you for all those that serve.
I do have a comment just in general. If anybody knows anybody on Medicare, there were a lot of prescription cost changes this year. So one of the new things is the Medicare prescription payment plan. And so a lot of people will notice their copays for their meds have increased because it's a percentage versus a flat copay. If you look up the Medicare prescription payment plan, it'll explain some information, but if you'd like, I can forward some resources that I have and send to everybody. I'm just trying to get the word out there because it was not relayed to really anybody well. And my team at work has been getting a lot of cost referrals. So just trying to get it out there and I'll share those resources.
Absolutely. We'll pass them along. Thank you.
Thank you, Amory.
Do you know with the change, has there been an increase in like the Medigap?
The donut hole is no more. So rather than paying your copays and all of a sudden they don't pay anything, what they wanted to do is you pay up to $2,000 and then the meds are free the rest of the year. So you can either pay $500 4 months in a row for a really expensive med, for example, or you can spread that $2,000 over 12 months and you make a payment to the insurance company versus paying a copay at the pharmacy when you pick up the med.
Oh,
So-
wow.
Mhm.
Thank you.
Mhm.
All right, any other public comment? Justin, do you want to introduce your intern before we close?
So this is Brianna Carpenter, everyone. She's from Eastern Michigan University, and she is studying public health education. I always get that confused about exactly what her title is, but that is what she's studying. So she's with us till April, and then she in April will present what she's done with us and a little presentation to the whole board and kind of go over everything about what she's learned and the community impact of the marijuana work that she's been doing with us here during her time.
Hope you have a nice experience.
Yeah, she's our first intern we've had since before COVID, I believe. So we resumed that program a little bit.
All right,
Thank you.
since
for-
we have no other business, I'll make a motion or at least accept a motion to adjourn.
I'll give you a motion to adjourn.
Thank you.
I will support it.
All right, all those in favor, say aye.
Aye.
Any opposed?